Hello, this is Mr. Lavery. We're going to start sudden illnesses, but really focus on breathing issues. So this is under that topic. Um, Wrong way. So you just finished infant choking. One of the things when people are having trouble breathing or suffering a heart attack or they're losing blood is they're going to suffer from shock. Shock is a life-threatening condition in which organs are not receiving vital blood, life, oxygen, nutrients to their organs, their brain, their heart. And it could be due to a serious accident. It could be to a breathing emergency. Um, Shock is the opposite of homeostasis. Signs and symptoms of shock include restlessness or irritability, changes in level of consciousness, pale, ashen, or grayish, cool, moist skin, rapid breathing and heartbeat, excessive thirst, nausea, or vomiting. So, shock, we're not talking about like, oh, you were shocked. Yeah, that could be a problem. Don't get me wrong. This is more of a trauma. This is a physical trauma. We have to survive the physical trauma to then address the mental trauma. Okay. And that's what we're talking about first aid and CPR. That this person is going into shock. Their body has been physically traumatized. That's the opposite of homeostasis. And if somebody is in this situation, a severe accident, call 911 or the designated emergency number immediately and then have the person lie down if possible. Control bleeding if necessary. Cover the person with a blanket to prevent loss of body heat. So, due to the fact that their homeostasis is disrupted, they're going to start losing body heat and cold, and that's bad. Even on a hot day, maybe. Do not give the person anything to drink or eat, even if the person complains of thirst. I'll tell you stories, but we don't want them to drink or eat because they could have an internal injury you do not know about and they may need surgery. Reassure the person until EMS personnel arrive. So we're going to skip over heart attacks. We're going to go to breathing emergencies. So breathing emergency can result in shock. It's a problem. We need oxygen. Signs and symptoms. Obviously, no breathing. We're going to check the scene. We're going to obtain consent if we need to. And we're going to check for responsiveness, check for breathing, and start CPR. Shortness of breath or trouble breathing. Remember, if someone's not breathing right and they're unconscious, you have a decision to make. Do you do CPR or not? Otherwise, we need to call 911. Don't put them in the car and think you can drive them. Call 911. Being unable to talk without stopping for a breath in between every words. Changes in breathing rate. Is it fast or slow? Is it shallow or deep? Or is it rhythm regular or irregular? Signs and symptoms. Continued. Gasping, wheezing, gurgling, or high-pitched noises. People with asthma suffer from this. Emphysema, bronchitis. Changes in skin color. Pale, ash, and bluish flushed skin. If somebody's blue, they're not getting enough oxygen, or they're cold. They could be really red. Temperature cool or condition. Do their skin feel moist? Are they dizzy or lightheaded? Do they have chest pain? Or do they suffer from apprehension or anxiety? If a person is having trouble breathing, determine whether to summon EMS personnel. This might be a care first situation. This might be a call first situation. Help the person to rest in a comfortable position. Sitting and leaning forward slightly often helps to make breathing easier. If the person is finding it difficult to talk, phrase questions so they can be answered by nodding or shaking their head. And we'll get to that. Like asthma. Do they have an asthma inhaler that will help them? Should we call their mom and dad? Yeah, there's a lot of decisions to make. Sample definitely helps. We'll review sample. So I got something in mind. If the person is having trouble breathing, often offer to help the person with his or her medication, an asthma inhaler, an epinephrine auto-injector if appropriate. Continue to watch for changes in the person's condition. Be prepared to give CPR and use an AED if the person becomes unresponsive. So this is our introduction to breathing emergencies. We're then going to take a look at asthma and then anaphylaxis because it can lead to breathing emergency. We're going to look at the text and you're going to do some independent work. Good luck.